Hello, welcome to my channel. This is Dr. Erica. Thank you for joining me on today's live chat. Today I have just some information about the J&J vaccination, the Moderna vaccination, and the Pfizer vaccination. This information just pertains mainly to its upkeep and dosing interval frequency in both pediatrics and adults. And also I talk about beyond use dates, like how long to keep it in the fridge or how long to keep it at room temperature, how long to keep it after first puncturing it, the vial. So I go over that information in this particular video. Okay, so the first medication vaccine for COVID-19 is going to be let's start with Pfizer. Okay, so Pfizer is pretty popular among the vaccines of choice, and it comes both pediatric and it also comes for adults as well. Okay, and it is in a vial where it can be reconstituted or it can't. So you just have to remember which vial is which. So the vial that is for Pfizer that does not need any dilution or any reconstitution, that means there's one vial of powder, which is the active ingredient, and then there's one vial of saline solution that needs to be reconstituted or added to the vial that has the active ingredient powder. Okay, and it is the Pfizer. It comes in a gray, comes with a gray top on the vial, and it's for ages 12 plus. And it is what you're going to do is it's non-diluted, so that means it's already in a liquid form. The only thing you have to do is insert the needle and the barrel and pull out 6 doses per vial, and that's going to be 0.3 mils on the first interval. Then after 21 days, the patient is to come back for the second dose, and then after 28 days, they come back for the third dose, and then 5 months after the second dose, they come back for the booster. And in one of my videos previously, I talked about whether Pfizer causes stroke, and it has caused stroke in a few cases, but the officials have said that it's okay to go ahead and continue with boosting patients that are over their certain age of, which is 65. So we do encourage that. Okay. Then also there is a Pfizer from Pfizer, a vial that is required to be diluted, and it's required to have a 1.8 milliliters of sodium chloride added to the powder form. Okay, and it is 6 hours at room temperature only good for 6 hours. It can be used in the stored in the fridge or the freezer, and it has a total of 6 doses after being reconstituted. So do be informed of that. So after reconstitution, you get 6 total doses, and then it has to be discarded after the after 6 hours of room temperature. Okay, and then the pediatric form of Pfizer, which is from age 5 to age 11, there is a dilution requirement of 1.3 milliliters of sodium chloride. So yes, it has to be, and it comes with the orange top to the vial, and it has to be diluted with 1.3 milliliters of sodium chloride. And it's good for at room temperature for 12 hours versus the other that I mentioned was good for 6 hours. This one's good for 12 hours. And it's good for refrigeration at 10 weeks, okay? And a total of 10 doses will be rendered after the 1.3 milliliters of sodium chloride. Okay. The dosing interval is a little bit different for this particular pediatric population. The patient is going to get 1.2 milliliters. Then they're going to, after the second dose, 21 days, they'll get another 0.2 milliliters. Then after 28 days, they'll get an additional 0.2. And there's no booster that's required. Okay, for J&J, J&J is indicated for those patients over the age of 18. It comes in a blue top, and no dilution or reconstitution is required. And the beyond use date is 2 hours at room temperature, and then 6 hours in the fridge. Okay, so it's 2 hours at room temperature and then 6 hours at the in cool states. So the total amount of doses per vial is going to be 5. So that's no reconstitution that's required. And it's going to be 0.5 for the first dose. And the booster is 2 months after. The booster is 2 months after the first dose of 0.5 milliliters as well. Then, last but not least, we have Moderna. Moderna is indicated for patients 18 and over. It comes with a red cap, and there's no dilution required. It's good for 12 hours at room temperature, and a max of 20 doses will be in the vial. 0.5 milliliters after 28 days, another 0.5 milliliters after another 28 days, and the booster is 5 months after that last dose of 0.25, half of 5 months after that last dose of 0.25, half of the initial and the second dose. Okay, and that's the information that I have to share. This information is available on the website for these particular particular brands, and please do comment and give any suggestions on any information that you would like for me to go over. Okay, if there's any other information, please let me know. Please like and subscribe to this channel. I'm Dr. Erica, pharmacist, and whatever new information that I have to give, I'll be happy to share with you through the American Pharmacists Association, also through the information that I have studied and have learned in retail pharmacy and have been able to preserve and bring back to this channel. So thank you again. Visit my website, themillenniumpharmacy.com. Themillenniumpharmacy.com. I'm Dr. Erica signing off. Thank you. Have a great day. Bye-bye.